Okay, welcome to the second part of reproduction in human, whereby we discuss about sex issues. So, what happens here is that this is the portion whereby we have to be talking about the sexually transmitted conditions as well as what are some of the temporary birth control methods available. So, family planning helps to allow married couples to decide on either when is it a suitable time to have children and the desirable number of kids. And these are important as it helps to as this helps to actually ensure financial capacity and as well as career planning for the family. So some ways to help aid or to control when is it timely to have kids or what. Some would actually adopt birth controls. So birth controls are ways to prevent pregnancy by blocking the events in the female reproductive system, for example, ovulation, fertilization, or implantation. So there are two different modes of prevention. Either it's a temporary effect or it's a permanent effect. So let's look at the temporary types of birth control, in which for temporary birth control, it only prevents pregnancy through a short period of time. So this can be actually reverted once you remove the birth control method lah. So once the prevention is removed, the couple will be able to have children, and the methods can be classified under chemical, natural, or mechanical. So for temporary birth controls, one example is through abstinence, and the nature of the method is actually natural. So this can be applied for both male and female, in which the mode of prevention is fertilization. So what is this abstinence? Abstinence means you refrain from actually having sexual intercourse with others. That means you have exhibit some form of self-control. The second one is the rhythmic method, and this is where you are there to actually use a calendar and to count when the days of ovulation happens or when the fertile period happens. So you try to minimize having sexual intercourse during that period of time. So it's a way to prevent pregnancy by not having sex around the fertile period. And this is a natural method, and generally it is affected at the female body lah. The event that we are trying to stop is the fertilization. Following this, we have a physical method of prevention, which is the condom, and this is a mechanical kind of prevention. Condoms, there is both for male and there's also for female. So for the female condom, we call it a cap and diaphragm, which we will cover later. But mainly, the condom helps to prevent the the meeting of your sperm and your ovum. Okay, so this is basically a rubber latex kind of tube, right? That prevents the deposition of sperm, and this is usually placed on the male penis. Okay, there's also a female condom that is inserted into the vagina lah, but generally it's for females they tend to use the cap. So for the cap, it's mainly another type of female condom, and this is usually placed and fitted at the cervix by a doctor. Okay, why? Because it's actually inside. So it's very hard for the female to actually put it inside. So this will help to act as a physical barrier to stop any sperms from entering the uterus. Following this, it will be your IUD or intrauterine device, and this is where it is done at the female end, and it is made out of a coil of a metal or plastic, and is fitted in the uterus by a doctor. This method will not prevent fertilizations to take place. However, the fertilized egg cannot implant itself into the wall of the uterus, as the wall is usually blocked by the IUD. Okay. Next, we had actually the contraceptive pills or the birth control pills, and this is chemical in nature, taken orally by the female to prevent any form of ovulation. So these pills will contain hormones to stop ovulation and hence to prevent the release of the ovum by the ovary. For this to be effective, the female would have to take the pill usually on a daily basis. Okay. Then we have the spermicides. So this is either like a cream or what, which is in a chemical form, and can be applied at both the female and the male, such that such that it will actually kill off the sperm, and this is usually placed at the vagina before having sexual intercourse. Most of the male condoms are also coated with spermicides in order to kill off the sperm. Now let's look at the permanent portion of birth controls. So couples that cannot have children in the future, right? Reason being is this method is actually very difficult to control to reverse lah. So once done, right, it's really like very no turning back, okay, kind of thing. So sterilization is this permanent method of contraception, and that this is an action or process for which the individual will become incapable of reproduction. Now, do take note, right, that this doesn't mean, right, that you cannot produce your sex cells. You still can. It's just that you will not be able to release it lah, release the sex cells out of your body. So the male sterilization is what we call a vasectomy, while a female is what we call tubular ligation. So for a vasectomy, it's the male sterilization method, and the sperm ducts are usually cut and tied to prevent the transportation of sperms to the penis. The man will actually become sterile because he cannot make a woman pregnant anymore. A vasectomy does not prevent the male to have actually an erection or the ejaculation of a semen, and this semen will not contain any form of sperm. So do take note that the testis is not removed, so therefore it can still be producing sperm. It's just that it cannot be released due to the sperm duct being cut off. Tubular ligation, so this is the other one where it's common in exam, where sometimes they will draw a picture like of the female reproductive system, and they'll ask you to indicate with an X where the tubular ligation should occur. So it's usually done right over at this portion here. For the male, it will be cutting at the sperm duct. So the fallopian tubes are usually cut and tied, and the sex gametes will not meet for fertilization even if the sperms are deposited into the vagina. So this is another thing to take note. Same method. Yeah. So then comes into the next one, which is abortion. So abortion is deliberate termination of a pregnancy after sexual intercourse, and this happens only after the three events, right? The fertilization, ovulation, implantation has already more or less occurred lah. Not so much on implantation, but more towards on the first two. So these fertilized eggs will become an embryo, and in the abortion, the embryo is removed deliberately. That means you forcefully remove it, and this is actually a very, very dangerous practice. Why? Because the uterus and fallopian tube may be infected, which will cause infertility. Meaning, when you go for abortion, there's a chance that you cannot get pregnant again. Okay, and death may occur due to great loss of blood, and this can be if you do it yourself lah. I mean, this one. But more importantly is this death, right? Is actually dangerous, not just to the baby but also to the mother lah. Okay, and abortion is also a controversy matter because it involves human morality. So why we talk about human morality is like you ending the life. Okay. So premarital sex, so what is it? Generally, like pre means before, marital means marriage. So premarital means before marriage sex. Is having sexual intercourse before marriage, and it's not a healthy act as the girl may have an unwanted pregnancy at a very young age. This will also expose teenagers to the risk of sexually transmitted infections at a very early age. So next we come in to discuss what are some of these sexually transmitted infections. So these are actually infections that will acquire through the body contact of an infected partner during sexual activity, such that it is transmitted. So STIs can be transmitted either by bacteria or by viruses. And the three very commonly sexually transmitted infections are cholera, syphilis, and AIDS, which is acquired immunodeficiency syndrome. So these are the names of the diseases. Now, it's very important for you to know what is caused by bacteria, what is caused by virus, because for bacteria, right, those that's caused by bacteria, it's easier to be able to manage it. Whereas for viruses one, right, sometimes taking medication do not end it. So second thing is in exam, how they will test is they ask you for the example as well as the description, like how what you should actually see. So basically for gonorrhea, it tends to affect the cervix, uterus, urethra, the rectum, anus, and the throat. And this can be treated very early by antibiotics, where the antibiotics will help to fight off the bacteria or the infection. Some of these symptoms may appear anytime from 1 to 14 days after being infected, and it is also possible to be infected without any symptoms being shown. So what can it cause? It will not cause much to the parents, but mainly to the baby, to the subsequent offspring, where they can cause blindness or even infertility, meaning you cannot actually give birth or reproduce. So in males, how you can see is that you will have a yellow or white discharge from the penis, and this can actually cause irritation or discharge from the anus. Why anus? If you have anal intercourse or what's not. The inflammation of the testis and the prostate gland. Okay, that means you can see it swollen and things like this. In a female, the yellow or greenish color of vaginal discharge develops with a strong smell, so it tends to be very smelly, and there'll be a burning sensation, either a pain or burning sensation when you actually pass urine. There's also irritation and discharge from the anus. Syphilis is another one that it can be transmitted through unprotected sex with an infected person, or even from a mother to an unborn child. So in this case, how you can be treated is when the person's blood will always show positive result to this infection. And if there are three main stages and signs of it, basically, right, there's also complications that takes place at the tertiary stage. So this one we will discuss more subsequently, but it's actually a bacterial kind of thing. So how it happens is it takes place after 3 weeks of infection, where it leads to a painless sore appearing at the location where the bacteria gain entry, usually at the penis of the man or in the vagina of the female, or even at the cervix. The second stage is whereby after 3 to 6 weeks of the primary stage, there is a non-itchy rash covering the whole body or in patches. It can lead to hair loss or even sores on the mouth, genitalia, or even the throat. That's the second stage. The third stage is whereby it's the most painful one. First, you have heart failure. Then second, your nervous control may lead to paralysis, deformed joints, or even insanity. You go blind, then eventually you will die. Very painful way to die. Okay. Now comes the more important one, which is AIDS. So AIDS is actually caused by a virus, and the name of the virus is what we call HIV. So in exam, if they ask you for the name of infection, don't put HIV because that's the name of the virus. But if you are required to name the virus that causes AIDS, you have to spell it in full: human immunodeficiency virus. You cannot spell it short from HIV. Okay. So HIV helps to weaken the immune system of a person, and that the person's immune system will gradually become too weak to fight off the disease. So in a sense, the name HIV comes from um, the key word here is immunodeficiency. So immunodeficiency means the decrease of your immune body system. Okay, and once your body doesn't have sufficient immune system, you are very easily being attacked by other kinds of disease, like a common cough or a common cold can also kill you because you have no natural antibodies to actually fight them off. So AIDS is actually the most serious stage of HIV infection, and at this stage, the person's immune system is completely destroyed and is now susceptible to other types of infection and disease. So because of this, the AIDS patient will then die of other types of disease, not by HIV itself. So HIV tends to weaken the immune system. But what kills the patient is due to um, the other forms of diseases. So if you get AIDS, will you die immediately? Not very true, unless you have a lot of ability to ensure that your immune system is still up to date lah. For example, you take medication and whatnot. So in terms of mode of transmission, HIV can be transmitted. Very important. This in exam. They will ask you a few scenarios. It is transmitted from one person to another person through either unprotected sex, sharing of needles, from a mother to the baby before birth, during birth, or through breastfeeding. So one key, and then it is not transmitted usually by sharing of utensils, public use of swimming pool, toilets, hugging, or even insect bite. So one key thing to take note is this mode of transmission must have the exchange of bodily fluid. That means by like blood or what law kind of thing. Okay, if not, it's very hard to pass through. So you can see the bottom one, right? When we talk about all the other ones which is not transmitted, it's because we have the human skin as the first physical barrier to prevent the exchange of this infection. So for some of the signs and symptoms, how do you know if you have AIDS? Okay, the early symptoms generally appear 6 to 12 weeks after the infection, and that some of these symptoms can include loss of appetite, night sweat, prolonged fever, swollen glands, skin rashes, sore muscles and joints chills. It is also sometimes possible for these people to not experience any of these symptoms at all until even when they are infected. So the best way to do it is through a blood test. And for all males, right, after national service, you are required to take a compulsory HIV test. So this is one other thing lah. So modes of prevention of STIs, the infection of HIV and other STIs can be prevented through the following modes. Okay, first, being faithful to one sexual partner, and this sexual partner should not be an infected person. Okay, so it should be just only having one, not having multiple. Abstinence from sex, that means totally don't have sex at all. Okay, having protected sex to minimize the exchange of bodily fluid, or not even sharing any items that can contaminate your blood, like drug needle, shavers, toothbrush. Hence, all these things generally, like let's say you go dentist lah, you go make tattoo, right? You must ensure that the needles used, right, are all thoroughly sterilized. Only when it is sterilized properly, then they can ensure lah that there's very minimal chance lah of this kind of potential transfer. Okay. Yep. So that's all for this chapter. We have come to the end of reproduction in plants. All the best to your exam. Thank you.